All right, welcome to The Explainer. Today, we're going to talk about something that, well, it probably makes most of us clench our jaw just thinking about it. We're talking about that dreaded numbing shot at the dentist.
I mean, you've probably been there, right? You're in the chair, you get the shot, your lip goes all tingly and numb, but then the dentist starts to work and wham, you feel everything. It is so frustrating, it's painful, and it turns out it's a way more common problem than you'd think. So let's get into it and figure out exactly what's going on here.
So, yeah, this whole thing, this unnumbable tooth, it's not just in your head. It's a real phenomenon. It actually has a name, and there's a ton of science that explains why it happens.
Okay, so the official fancy name for this is Symptomatic Irreversible Pulpitis. But for you and me, we just call it a hot tooth. And what that means is the nerve inside your tooth is just so angry, so severely inflamed that it's actively fighting back against the anesthesia.
And what's really wild is that it's not just one single problem. It's like a perfect storm. See, that inflammation creates a really acidic environment, which totally messes with how the anesthesia is supposed to work. And at the exact same time, the nerves themselves get all hyper-excited. They're basically screaming so loud that they completely drown out the numbing agent. And just look at how big of a deal this is. A standard numbing shot works great on a normal tooth. We're talking an 85% success rate. But on a hot tooth, oh man, the success rate just plummets. We're talking down to 29%. That is a huge drop. And it really explains why things like root canals have such a bad, painful reputation, doesn't it?
So you can imagine, for years, dentists and scientists have been on this quest for a better way. And that brings us to this really cool new clinical trial that basically set up a showdown, a head-to-head competition to finally figure out how to conquer the hot tooth. Yep, researchers decided it was time for a proper test. This comes from a double-blind, randomized clinical trial from the Journal of Endodontics, where they pitted two very different but very clever new approaches against the standard method. All right, let's meet the challengers. In this corner, we've got the more juice method. It's pretty much what it sounds like, just double the dose. 2 cartridges of anesthetic instead of 1. Kind of the brute force approach, right? And in the other corner, we've got the big chill. This one uses a normal single cartridge, but it's been pre-cooled down to a chilly 4 degrees Celsius. That's about 39 Fahrenheit. So who's going to win this showdown? Well, the researchers were smart. They measured 2 really important things. First, how much does the shot itself actually hurt? And second, the big one, does the numbness actually work? And you know what? The results were pretty surprising. Okay, first up, the pain of the shot itself. And for anyone out there with a bit of dental anxiety, you know this is a huge deal. A gentle shot can change the entire experience. So the patients in the study had to rate their injection pain on a standard scale. And wow, the results here were, honestly, they were stunning. The big chill was the clear runaway winner. No contest. That cold anesthetic caused way less pain than the regular shot and the double dose shot. The thinking is that the cold itself has this mild pre-numbing effect, which just makes the whole thing a lot gentler. Pretty cool, right? Okay, so a less painful shot, that's a massive win. But that's only half the battle. The real test is, does it actually work? Does the numbness hold up when the dentist starts the procedure? So let's see which method delivered when it really counted. All right, so the more juice method, the one with 2 cartridges, it posted a really impressive 80% success rate. Think about that. 8 out of 10 patients with one of these impossible-to-numb teeth felt no pain during that initial drilling phase. That's a seriously strong result. So what about our other challenger? The big chill came in right behind with a 76% success rate. I mean, that is also a fantastic result. It shows that just cooling the anesthetic is almost as effective as doubling the entire dose. But let's put both of those numbers into perspective for a second, because this is where it gets crazy. The control group, the folks who got the normal single room temperature shot, their success rate was just 6%. 6! So going from 6% to 76% or 80%, that is absolutely monumental. This is a true game changer. Okay, so where does that leave us? We've got a super gentle shot on one hand
and a slightly more effective shot on the other. So how do we pick a winner? Well, as it goes with a lot of science, the answer, it's not that simple. It's a bit more nuanced.
And that brings us to the final verdict, which is really a kind of trade-off. If the number one priority is just pure, reliable, deep numbness, well, the data says more juice has a little bit of an edge. But if the goal is to maximize patient comfort and minimize injection pain, then the Big Chill is the obvious champion. And it's still a really, really effective option.
The study's authors really hit the nail on the head. They wrote that while increasing the dose appears to give a more consistent and reliable improvement, the use of cold anesthetic solutions is, and I'm quoting here, still a viable option. It's a great practical way to improve patient comfort without adding more drugs, especially in these really tough cases. So, what's the bottom line for you? Well, first, it means a less painful injection is totally possible. Second, your dentist now has better, proven tools to deal with these awful hot teeth, and that can lead to a lot less anxiety for you in the dental chair. What's really great is that there's a super simple, non-drug improvement just sitting there. And finally, it empowers you. Now you know you can ask your dentist about their approach to this exact problem.
And it kind of leaves you with this one last interesting thought, right? We always think progress has to be this super complex, high-tech thing. But this study shows that a solution as simple as what? Sticking a cartridge in the fridge could fundamentally improve one of the most feared parts of going to the dentist. It really makes you wonder, could the future of dentistry actually be cooler?